Hello everyone, good afternoon. This is Dr. Zibi. My presentation today is going to be on the impact of substance abuse on mental health in children. So as we all know, substance abuse these days is a growing concern, everywhere, not just here, but also where we're coming from. Kids are exposed to that early, and that can lead to severe and lasting mental health issues. So it's very, very important as parents to know these things, the impacts of those drugs in our children's life, and that is going to help us to prevent and to intervene as soon as possible. So what are the substances that are commonly used by children? We have alcohol, we have tobacco, we have marijuana, we have prescription drugs such as your pain medication. If you're on oxycontin, make sure you know how to put that in the safe place. We have stimulant like Adderall and so forth. We have illicit drugs such as cocaine, methamphetamine, and others. And when those kids are using those substances, we have short-term and long-term effect. So the short-term can be, anxiety, can be depression. It can trigger anxiety or triggers depression, and also triggers cognitive impairment. Some kids, when they smoke or drink, they become cognitively impaired. So it means that the attention, decision making is affected. All right, so the long-term mental health effect of those drugs, we have development of psychotic disorder. We have the impact on the brain. We know that the children, when their brain is still developing, so if they use those things, that is going to impact development. We have also the increase of suicidal thoughts and behavior. So what are the consequences? The consequences can be behavioral, so academic decline. A lot of kids who start using drugs, have poor school performance, and also there's a higher dropout rate in school. We have social withdrawal. Those kids are isolated, from family and peers, and also it can increase aggression, behavior problems. All right, so what are the factors, the factors of substance abuse? We have environmental. The parents, do the parents have history of substance abuse, or are they using substances? Peer pressure. A lot of our kids go to school, and the friends, if you don't use this, that means you don't belong to this group, and they find themselves using what they have no business using because of that pressure. Lack of supervision. Parents, let us supervise our children. Let us, be there for our children. Okay, we have mental health disorder. Children with existing mental health issues are at higher risk. If you have a child who has mental health issues, it's easy for them to use those substances, because when they're using, maybe because they're having things like racing thought or so forth, that when they use this drug, they feel like their mental challenges kind of go down. Okay, so what are the prevention and the intervention that we can have is education and awareness. That's why I'm making this video, to educate parents. Okay, mental health support. We can access counseling and mental health services. There's no shame of seeking mental health counseling and services. All right, parental involvement. Be involved in your children's life. Don't just leave all the time, go to work, come back, you don't know how your child's day was. Get involved, be active, be there, communicate with those children, supervise your children. All right, so what are the takeaway? As I said, substance abuse in children is a serious issue, and with long-term mental health consequences. Early intervention is very crucial to prevent and mitigate the effect of substance abuse in our children's life. Okay, so we need to collaborate. Parents need to collaborate with educators, need to collaborate with healthcare providers. It's very essential that we collaborate. This is all about our children. I thank you all for listening, and I love you. We have a great webinar coming up next month, and we're going to talk more about it. Again, this is Dr. Zibi. I'm a psychiatric mental health nurse practitioner and substance abuse provider. Good night.